just a quick review of the Can Do Theraputty. This is mainly used for two main things. One is stress relief, just getting some of this and squeezing on it, just like one of those little squeeze balls. And probably the more frequently use of this Theraputty, since it is therapeutic, is for hand and finger strengthening. It does come in 6 different resistances. That's why I have the green here. It does come in a tan, which is the extra soft, and that's the easiest one. Yellow is extra soft. Red is soft. Green is the medium one. That's the one I have here. Blue is firm, and black is the extra firm. So if you're looking for a place to start, I probably would start in the middle if you're unsure, kind of like with the red or the green. That way you don't get anything that's too hard or too easy. Then you can always adjust from there. The really thing I really like about this is that you really need the different resistances. If you're going to get stronger, you need what's called progressive resistance. So in other words, let's say you start with the green, and you can do that for several minutes to like you want to improve your grip. If you keep using the green week after week after week, you won't get any stronger, because your muscles are like, hey, I can already do this for like a couple minutes. I don't need to get any stronger or lay down any more muscle tissue. And so it's not going to get any stronger. So what you need to do is challenge the muscle, give it a reason to get stronger, and then move up to, say, the blue one. And then you probably won't be able to do it for a couple minutes, maybe 30 seconds. And then you build up to 2 minutes. You keep working your way up. So that's what I really like about this. There's so many different resistances. There are lots of places to go. Quickly, a few highlights. It's non-toxic. If you're working with this stuff and you leave it laying around, your dog comes up and starts chewing on it and you don't have to worry. It's got an easy open container, which is really important. A lot of people using this are going to have hand issues and finger arthritis. And, what good is this stuff if you can't get the darn thing out of the darn package? There's just a ton of different things you can do with this stuff. You can pinch it, squeeze it, twist it, just a wide variety of things. The main thing is just going to be squeezing it, most people. Now, if you have like say hand arthritis and you're looking for a set program, there's a couple of resources here that a lot of people don't know about I want to bring up. Treat Your Own Hand and Thumb Osteoarthritis. I think you can get this book on Amazon by Jim Johnson PT. Basically, this program is very evidence-based. It'll take you just a couple minutes to do, probably less than 10 minutes a day, which is not a huge investment in your time. A lot of people aren't really big exercisers, so they're not going to sit down and do like 100 different exercises for half an hour. It'll probably take you 10 minutes or less, this whole program. I'll give you just a few examples. Getting rid of that stiffness. Well, basically, your fingers are synovial joints, meaning that they have synovial fluid in them. And joints, these kind of joints, which are most of the joints in your body, they actually get their nutrition through the synovial fluid. So that's where the joint gets its nutrition from. Now, how does that synovial fluid get around? It gets around through diffusion or motion. So if your hand hurts and you don't move it, your joints aren't getting enough of that synovial fluid, moved around, and so it doesn't get as much nutrition. So if you really want to help out your articular cartilage, get rid of that stiffness, you got to do some range of motion exercises. And that's why if you go to like occupational therapy, they'll start out with range of motion exercises. So this has a real few of them for you to do here. The other thing besides range of motion and getting the articular cartilage, plenty of synovial fluid, is making your hands stronger. So basically it gives you a few exercises for that you can do like with a dumbbell. You can also use this in addition to your putty. So they give you some strengthening exercises. So yeah, there's just how to increase coordination in your hands. A lot of times when people have arthritis, they lose coordination. This gives you a quick little fun exercise you can do while you're sitting around watching TV with these exercise balls. So here again, really good resource. If you have a thumb arthritis, this is another one. You just don't see thumb arthritis books out there, any good ones. But here again, this one I think you get on Amazon as well, the Healthy Thumb Handbook. Or if you just have any kind of thumb issues, this is pretty good. This book contains some things you don't really see unless you really go to therapy. For instance, if you have thumb arthritis, you have pain coming from the joint, but if the joints get irritated, a lot of times the muscles get irritated as well. So not only do you have pain coming from the joint, but you have pain coming from the muscles. So the muscles develop these little things called trigger points. There's little irritable spots in the muscle. So you can iron those out, and this book will tell you how to locate them and get rid of them by squeezing and pinching and that kind of thing. And if you can't do it because both hands have arthritis, it comes up with a good alternative with a little clip there. So this book's really thought of everything. If you have thumb arthritis, you probably have a tight web space. That needs stretching out. That's something that you would only know if you went to therapy. Taking pressure off the thumb joints. Well, it teaches you a really cool distraction technique. Basically, joints that have arthritic, they really like traction, distraction. Okay, traction's the force and distraction is the effect. So anytime joints are pulled apart slightly, a few millimeters, it gets a chance for circulation to get in there, stretches them out, it takes total pressure off the joint, so it feels so good. So I'll teach you some joint distraction techniques for your thumb. Last thing, getting maximal joint stability. Well, a lot of people don't know this, but there's actually two muscles that attach to the base of your thumb, your abductor pollicis longus, according to this book. Let's see, the first dorsal interossei. Okay, these muscles attach directly to the base of the thumb, and they help actually stabilize your thumb joint. So when you have arthritis, you actually have a little bit of instability in the joint, and that's why the joints become enlarged, because it's trying to lay down more bone and more of the joint capsule to try and stabilize the joint. But you can strengthen these muscles, get a lot of joint stability down there. You're going to have a more stable joint, which means less pain, less joint destruction. So it gives you an exercise for that. Just a bunch of other things. But anyway, some good resources for you. You don't hear much about them. If you want a place to start, just grabbing the putty, getting your fingers moving, get that synovial fluid moved around. Theraputty is just a really good tool to start with. So yeah, definitely check it out.